goes for 3HO4, and it's the identifying illnesses part of this assessment. Now, I'm just aware of this horse's behaviour. Hypothetically, if he was ill, he might be agitated, he might not like being separated from his friends, which, as you can see with the stable door there, I've just made sure that his friends are locked out the back so that they can't cause him any agitation. He's tied up using a halter that fits him appropriately, and he's once again using a quick release knot. Now, to identify lameness in a horse, there's many different ways. There could be heat or swelling, but primarily you could identify lameness in a horse by watching them walking around the paddock. The best way is to have someone trot them on a loose lead in a straight line back and forth, and that way you can see whether their diagonals are even, whether there's a head bob. That is one of the key ways of discovering lameness. I can demonstrate a trot out in a moment. Okay, now if we're looking at sore eyes, we'd have a look at the horse's eyes. This horse doesn't have sore eyes, but if they did have sore eyes, there might be they might be watering, they might be red and irritated and swollen, there may be a bit of pus coming out. This is quite common when you have flies annoying them, for example, but those are some ways you'd identify sore eyes. The horse may also be rubbing their face on their legs and things like that just to try and get rid of that irritation. Next we have a sore mouth. So if we were looking at a horse and trying to identify whether he had a sore mouth, you would look on the sides here to see whether there's any marks from his bit. You could also just open his mouth up just to see if there's any wounds in there, in which his gums are a nice colour, there's no injuries to his gums, and his lips are nice and healthy and soft, and he has good capillary refill on his mucous membrane, so his mouth appears quite healthy. This horse has been eating normally. Now, if you did have a horse with a sore mouth, you may see sores on the outside from their bit. The horse might not be eating. That could be related to dental problems or if they've got a sore in their mouth. So it could be also in their behaviour. If you put a bit in their mouth and you can't externally see that there's an issue, when you start riding them with that bit in their mouth, it might aggravate it and they might start becoming uncooperative or playing up. Okay, next on our list we have girth galls. Now, to have a look at girth galls, we just run over and underneath the horse to see if there's any displaced hair, any wounds, any abrasions, any lumps. There's none under here that I can see. The horse has got no tenderness. He's not flinching as I'm running along here. Now, we would check the horse before and after riding for girth galls just to make sure that our equipment's not rubbing him. Just do the same on the other side. And once again, there's none on this side. Okay, so he doesn't have any girth galls. Now, back conditions, there's lots of different ways to check your back condition. The horse may be out like chiropractor wise, so you can just press along his back to see whether there's any tenderness or pain there. You can do that along both sides. Just a flat fingers, just giving a bit of pressure there. Okay, so this horse doesn't appear to have any tenderness in his back, which is good. Another way you could tell a back condition as well is if he had no top line underneath his saddle may fit poorly, which would cause these muscles here that sit underneath your saddle to not form correctly. Okay, and now if we were looking at mud fever or damaged feet, mud fever is very similar to greasy heel here where we live. So what you'd be looking for would be little wounds that have scabs on them that are a bit pussy, and it looks like there's mud caked onto the wound, but it's actually a scab. There's usually a bit of heat in there. There's usually quite a bit of swelling. Mud fever in particular can cause swelling right up their legs, whereas with greasy heel it's more really located just on the area where the greasy heel is. Now, with their lower limbs, we just check over them each day before we're going to ride, making sure that there's no wounds there, just to make sure that when we are riding we're not aggravating anything. We're checking all over. Now, this horse doesn't have any wounds on his legs. I am keeping my hand on him as I'm walking around him so he knows where I am. I'm checking all 4 feet. We check underneath his feet as well, so we get him to pick his feet up. Yep, that's the way. There's no wounds there on his legs. That's good. And as I said, if there's a sick horse and he has issues, his behaviour is a really, really good way of telling that there's something not quite right. Now, if the horse did have injuries or any of these things that we've just discussed, you'd probably need to document it, depending on what the injury was, also call your vet. But documenting it and keeping it for your records is also a really good way of showing the horse's progress. And whether there's common problems coming up, for example, with the back problem, if it was because of a poorly fitting saddle, it might be a reoccurring problem and might have reoccurring soreness. Right, that's it.